Miss Russell. I'm Erica. I'm going to be your nurse today. Is there a better name I can call you?
Molly's fine.
All right, Molly. What can I help you with today?
Well, unfortunately, I lost my husband about a year ago to a heart attack suddenly. And that really freaked me out. So I'm here to help educate myself so the same thing doesn't happen to me.
Mm-hmm. Can you tell me more about your concerns?
Well, my husband and I, we had no idea the signs and symptoms of a heart attack, and I didn't know what to do when it was happening, and this really freaked me out. So I'm here to just educate myself as much as possible to prevent this from happening to me.
Mm-hmm. What I hear you saying is that you would like to know more about the signs and symptoms of a heart attack in case one occurs in the future?
Exactly.
It's not uncommon for people not to know all the signs and symptoms and the increased risk factors of a heart attack. It's specifically tailored for women that all talks about heart attacks and their risk factors and symptoms. We can actually go through the brochure together.
Thanks.
Well, first, a heart attack occurs when for some reason blood flow to the heart gets blocked and the heart can't get oxygen. So heart attacks can be trickier to notice in females than in males because they are typically more subtle. You can see signs as early as a month before a heart attack occurs.
A whole month before?
Yes.
Oh my goodness.
These symptoms are usually fatigue, problem sleeping, shortness of breath, heart racing, and increased anxiety.
Wow, what is it going to look like when I'm actually having a heart attack?
Well, there's quite a few signs for females once the heart attack actually occurs. These can be cold sweating, dizziness, nausea, discomfort in the chest, and pain in the jaw, arms, or neck.
Okay.
Are there any of these that stick out to you?
Well, I mean, these all really freak me out, and the fact that they're so subtle, that scares me. And that's why I'm here today, is to be able to learn these signs and symptoms so that I can be aware as a female what to look for. So I feel like I'm becoming more prepared for that.
Mm-hmm. You're right. Knowing the signs can stop a heart attack from occurring. I would prefer it never got that far for you. So let's discuss ways to prevent a heart attack from ever occurring.
Okay.
First, there's many things you can do to help prevent a heart attack. These things can be reducing your weight and getting it within a healthy BMI range, below 25 we usually say, as well as eating fruits and vegetables, typically around 5 per day, and quitting smoking if you're currently a smoker, as well as managing chronic conditions such as high blood pressure, diabetes, high cholesterol, and managing and lowering your stress are big components for help preventing a heart attack.
Okay.
How do you feel that these compare to your current lifestyle now?
Well, I do not smoke. However, I definitely don't feel that I eat enough fruits and vegetables a day, and I do not work out at least 150 minutes per week, as this pamphlet suggests. And I'm not very good at managing my stress levels, so those are definitely things I'd like to work on.
Mm-hmm. So you're saying these changes can be made?
Yeah, I feel pretty confident about that.
How do you think you would make these changes?
Well, I do have a dog, so I could definitely work on taking him out for longer walks, to get some more exercise and relaxing for me.
Mm-hmm.
So it'll help decrease my stress levels as well.
That's a great idea. So if you make these changes, what do you think will be the biggest impact?
Well, I'll just be a more healthier, informed individual about my health, and I'm really looking forward to making these changes. Although I'm going to start slow, I'll start off with eating more fruits and vegetables, but I think I can definitely commit to at least to walking with my dog more, for sure.
That's absolutely right. So, Ms. Russell, what are the things you've learned today?
That heart attacks in women are very subtle, and I had no idea, so I've learned what to look for as more signs and symptoms that I can be aware of, and how I can prevent those, and when I need to go see the doctor as soon as possible. So,
yes, those are all great. It's clear that you really do understand the signs and symptoms and how to prevent a heart attack in a woman. Do you have any
what to look for as more signs and symptoms that I can be aware of, and how I can prevent those, and when I need to go see the doctor as soon as possible. So,
yes, those are all great. It's clear that you really do understand the signs and symptoms and how to prevent a heart attack in a woman. Do you have any other concerns for me?
I don't. You did a great job explaining. This pamphlet is short, concise, straight to the point, so it's very easy for me to understand. I don't have any other questions for you at this time.
Well, that's wonderful. If you ever do think of other questions, I'm always here to answer them. I hope that you feel more comfortable after this discussion.
I definitely do. Thank you very much.
You're welcome.